Do you have back pain from a twisted pelvis? Like your hips aren't even, or one shoulder is higher than the other? Or maybe you've been to a chiropractor and they tell you that one leg is longer than the other. In this video, I'll show you how to fix a twisted or rotated pelvis with just one exercise and what to do to keep it from coming back in the future. Now, before we go through solutions for a twisted pelvis, we first have to explore what causes a twisted pelvis in the first place. Now, there are many causes of a twisted pelvis, and in this video, I'm just going to cover the most common one. And that comes because the human body naturally has some asymmetry to it. We have one heart, one liver, one spleen, two lungs that have different numbers of lobes. The right has 3 lobes and the left has 2. And so our bodies are not naturally symmetrical. But one big factor is that your liver is much larger on the right and your diaphragm is larger on the right. What that naturally does is causes you to tip over to the right just slightly because that side is heavier. Additionally, because many people are right-handed, they tend to have more muscle mass on that side. And so if you're tipped over towards that side, putting more weight on the leg, your body will make natural compensations to make your head come more upright and make you upright with the world. And how that happens is that you put more weight on that right side, your pelvis twists to the right, your body counter rotates to the left. That makes the left shoulder higher than the right one, the neck slightly side bent to the left, and the left hip slightly externally rotated. Now, I'm exaggerating this just for the purpose of the video so that you can see the abnormal posture, but keep in mind that this is not necessarily abnormal posture, that it's normal to be that way to some extent. So if you don't have any problems and you just notice that you're a little bit off or a little bit asymmetrical, that's okay. Nobody is perfectly symmetrical. But if it's gotten to the point where it's causing you problems like back pain or neck pain or shoulder pain or hip pain, dysfunctions like this can cause problems in many different areas. And based on other factors going on in your life, that may affect where that postural dysfunction expresses itself. But one very common place and where people tend to notice postural dysfunctions the most is when they have lower back pain. Now, when you have this postural dysfunction where your pelvis is rotated towards the right, your trunk is rotated towards the left, and side bent towards the right, that causes some muscle imbalances, particularly a muscle called your quadratus lumborum on the right side becomes short and stiff. That muscle runs between your pelvis and the lowest rib, your 12th rib. Its role normally is to side bend the trunk and also to stabilize the 12th rib as you breathe in or inspire. The other muscle that's involved in this pattern is the psoas on the opposite side. That attaches to the front side of your lumbar vertebrae and then runs down through the pelvis to your hip. Its normal role is a hip flexor, but it also flexes and slightly rotates your hip at the same time. So to undo this pattern, we're basically going to do just the opposite of the pattern. So if you're starting in a position of right pelvic rotation, left trunk rotation, right trunk side bending, we're going to do just the opposite pattern of that. However, if you notice that you have the opposite pattern, just reverse the lefts and rights with everything that I show here. So we're going to start in a position where you rotate your pelvis the other way. So rotate it to the left. Now you don't want to twist your whole body to the left. You want to keep your weight on the inside of the left foot. We're also going to go into slight hip extension on this side because again, the psoas is a hip flexor. And so you want to put the hip in slight extension and then rotate the pelvis to the left side. Now you're going to rotate your trunk to the opposite side. So you're going to keep the pelvis rotated to the left side, keep the hip in extension, which internally rotates this leg and relatively externally rotates the opposite leg. Twist the trunk to the right, and then you're going to side bend to the left and raise this arm up over your head. Now again, the quadratus lumborum on this side has a role of stabilizing the 12th rib as you breathe in. So to stretch, you're going to take a deep breath in and reach up towards the ceiling with this arm. Then breathe out and keep reaching up with this arm. So you're stretching the quadratus lumborum on this side. You're also stretching the psoas on the opposite side. Take another deep breath in, reach up towards the ceiling, and then hold that as you breathe out. Think about forcing air into your right lung. Of course, air is going to go into both lungs, but focus on trying to fill the right lung and expand the right rib cage. So take a deep breath in again. Breathe into the right lung, expand the right rib cage, reach up with the right arm. Again, you're keeping your left arm coming across your body towards the opposite knee, and that gives you the trunk rotation towards the opposite side. And repeat that for about 5 deep breaths. Now, I know that's a lot to take in, so I'm going to explain it one more time and starting from the beginning. So you want to go into a little bit of hip extension, stagger your legs just a little bit so that the left leg is behind you. That'll also help you create a little bit of the pelvic left rotation. Now you're going to counter rotate your trunk towards the right side. Reach your left hand down towards your right knee, and then bring the right arm up over your head. Take a deep breath in. Try to fill the right rib cage. Hold that and keep reaching up as you breathe out. Now you may notice this is a slightly off balance position. So if you do have some balance problems, make sure you're near a wall or standing in the corner. It may also help to lean towards the side of the wall, because if you're going to lose your balance, you're probably going to fall the way that you're leaning. So that's the exercise to help undo the postural dysfunction. And again, it's basically just doing the reverse of the dysfunction. But the things you do in your everyday life are what contribute to that dysfunction. Because if you're constantly falling into that pattern, then you're going to make the muscles, particularly your quadratus lumborum and your other psoas, tighter. And so it's important to pay attention to your posture during the course of the day, which actually has a bigger role in whether or not the dysfunction comes back. So pay attention if you're standing that you don't tend to load your weight out over one leg. If you're sitting, do you tend to always cross your legs in one direction or sit with more pressure on one hip than the other? Do you tend to sit on one side of the couch and always lean on one armrest or lean on the other armrest as you're reading or watching television? Those little tiny things that you do throughout the course of your day are what establish those muscle imbalances in the first place. Now, if you're not quite sure what those are, or you're not quite sure what dysfunction that you have, seeing a physical therapist who's experienced with these type of postural problems can help. And if you're in the St. Louis area, we'd be happy to help you out with that. Now, I mentioned at the beginning of the video that I would also cover some other causes of a twisted pelvis besides that natural postural dysfunction. And one of those is an SI joint dysfunction or a sacroiliac joint dysfunction. That's the joint where your pelvis joins with your spine, and there are a variety of reasons that can get into dysfunction, either from a traumatic injury, repeated asymmetrical twisting or loading forces, or when you're pregnant or after you've recently been pregnant. Another thing that can cause a twisted or rotated pelvis is if you have one leg that is structurally longer than the other. Now, I've got other videos that you can check out over here that cover those problems and what to do about them. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.